Hi, I'm Dr. Steven Ferguson, have a large medical practice in eastern North Carolina, little town called Powellsville. We're talking about withdrawal today, and particularly using a product called Suboxone. Suboxone is useful and helpful in helping you to withdraw from the narcotics. It's going to keep you from having the withdrawal symptoms, the night sweats, the irritability, the stomach pain, the diarrhea, the seizures. Suboxone is going to do that, but it's not going to take care of your stress. You got to do that part. So you got to put some other components into place. How are you going to handle your stress? Life can be stressful. How you handle it is what makes the difference. You have to have a way of handling your stress. And good nutrition, good exercise, good sleeping, all of those are important components when you talk about handling your stress. Another thing I encourage you to do is to sit down and write down the things that are stressful to you. Write them down on a sheet of paper. While you're not stressed, while you're watching TV, having a good time, write them all down. And next to those stress things, write down a solution. Okay? I get stressed every time my husband leaves his shoes at the front door. I get stressed when he leaves the top off the toothpaste. Okay, what's the solution? I can either leave the top off, I can put it on, or I can badger my husband to put it on. So which is going to be least stressful to me? And that's the one you need to choose. I get stressed every time I get to work because my boss is held my back, and he's, so what do you need to do? Maybe get to work earlier, maybe get to work later so you don't bump into him in the hallway. There's all kinds of ways of alleviating stress, but the first thing I do is identify it. What are your stressors? Identify what they are. A lot of times when a person's been hooked on narcotics, they got a lot of stressors. At least they think they have a lot of stressors. Once they start getting clean, they find out their stresses aren't really as bad as they thought they were. Once they start getting clean and knocking off the narcotics. Now, just a side note here. A lot of times when a person thinks they're stressed, then they start taking Xanax and Ativan off the street. Okay? So many times when you find one of your celebrities that died of alcohol, drug abuse, you'll find Xanax or Ativan in their system as well. I'd say 25 to 35% of my patients that come into my Suboxone clinic are also taking something like Xanax or Ativan. No, not good. They're addicting too. Those are benzodiazepines, and they're also very addicting. So I encourage you, don't try to replace one problem with another problem. Don't get stressed and then feel you need to go take something like that. Now, sure, you might be depressed, so you might need an antidepressant. So you might need to talk to your healthcare provider about having an antidepressant. That might be what you need. But don't just do it on your own. Talk to somebody, work with somebody. And again, those simple points of stress, you can do your own. You identify what they are and figure out how you can do them different. Well, me and my wife get into an argument every time I fix spaghetti. What's the solution? Don't fix spaghetti. So there's some solutions that are pretty easy. Some solutions are more complicated. Well, I get stressed when I have money to pay the rent. Well, that's a little more complicated. So what do we need to do? We need to plan. We need to maybe budget, maybe put away a little bit of money each paycheck, put away a little, get a system together where we're not so stressed about that. A lot of times stress can be eliminated by having a system, having organization, having a budget. Those are good stress relievers. The more organized you are, probably the less stressed you're going to be. There's lots of different ways of dealing with stress. Personally, I deal with my stress through Jesus Christ. But you have to have your method and way of dealing with your stress. And, once you get in our program, we're working with you. We'll many times give you some tips and helpful things you can do that might help you through the process. We're running a Suboxone clinic to help you come off the withdrawal from narcotics. We're here and happy to help work with you. So give us a call, 252-332-6484. This is Dr. Steven Ferguson signing off.